Good morning, everyone, and thank you for joining us this morning. My name is OLAYEMI DUROTOYE, and I'm a consultant pediatrician in conjunction with El Gracia Child Health Foundation of the state. This morning, I'll be speaking about preconception, antenatal, and postnatal care in children. To start with, what is preconception? Preconception is the state before a woman gets pregnant, and it's important that a woman prepares herself for this wonderful journey. And the reason is because the outcome of every pregnancy usually will depend on the state of the woman before she gets pregnant. So, preconception is one of the fundamental things a woman must prepare herself for the moment she intends to have children. So, what are the things to look for in the preconception period? The first thing to talk about is what is the mental state of the woman? What is her mindset about the child she's going to have? Is the pregnancy planned or prepared for? It's very important because a woman's state of mind during the state of pregnancy will tell on how the journey will be in the course of the pregnancy. Also, a lot of people are usually anxious before they get pregnant and even during pregnancy. A woman must address this issue of anxiety even before she gets pregnant so that she can have a fun filled journey. Talking about the clinical aspects, the things a woman must look out for, first of all, is her HB genotype. She has to know what her genotype is. Is she AA, is she SS, or does she have any of the hemoglobinopathies? This is because the fetus that is being formed in a woman takes from the red blood cells of the mother through the placenta to form its own red blood cells. So the woman's HB genotype and also her pack cell volume is important before she gets pregnant. Also, HIV status, very important, so that we can prevent mother to child transmission of HIV. And also, hepatitis B status is important also. These things should be looked into, and whatever the state may be, a woman must know these things before she gets pregnant. Also, her nutritional status, even her weight is important before pregnancy ensues. So when a woman is pregnant, I'm moving on now to antenatal care. Antenatal care is very, very important because pregnancy is for 9 months and childbearing or childbirth is anticipatory because a woman has a whole 9 months to prepare for the baby she's going to have. So, what are the components of antenatal care, or what is antenatal care itself? Antenatal care consists of all the series of health checks and health visits monitoring that a woman must have from the moment she gets pregnant till the time of delivery. Antenatal care is important because pregnancy, though it's a wonderful journey, also has a lot of highs and lows. And a woman may have one or two problems in pregnancy that, when it is detected during antenatal care, it can be tackled to make sure that at the end of the day, we have a healthy mother and a healthy baby. So, women are advised that the moment they discover that they are pregnant, they should visit the hospital for antenatal care. They should visit the hospital for antenatal care. Most women will know that they are pregnant after their first missed period or after their second missed period. And some women may even notice some spotting, they may notice some, bleeding or heaviness of their breast or tiredness. Those may be the signs by which they know that they are pregnant. So they can easily have a pregnancy test done. It can be done, in a pharmacy, in a nearby, in a chemist, or it can be done at home using a urine pregnancy test and pregnancy test strip. And once it is positive, women are usually advised to visit the nearest hospital or a health facility or health center to register for the pregnancy. And when they get to antenatal, for antenatal classes, they are usually taught about the whole journey of pregnancy, what to expect, what to eat, how to manage themselves, and their health is also checked. Their blood pressure is checked, their plaque cell volume, their urine is checked so that if there be any problems in pregnancy, they are easily detected and then they can be tackled before the pregnancy advances. Also, Ultrasound scans are done during the antenatal period to know, first of all, the location of the pregnancy, to be sure whether that pregnancy is intrauterine, that is it inside the womb, or an ectopic pregnancy, which is a pregnancy that is growing outside the uterine wall. And so that also needs to be looked into. And also to know the number of children the person is carrying. A lot of people just carry on with pregnancy, and by the time they get to the fifth or sixth or seventh month, that's when some people actually come in to register their pregnancy. And they find out that they are carrying more than one baby. So you don't want to have that shocker towards the end of your pregnancy. So it's better to do an ultrasound scan as early as possible the moment a woman discovers that she's pregnant. And so there are also other things to be done in the antenatal period. The vaccine tetanus toxoid is supposed to be taken. Intermittent presumptive treatment for malaria, that's malaria prophylaxis, is supposed to be taken also during pregnancy. And then a pregnant woman needs to rest well, to eat well, to have a balanced diet, because at that time she's not only nurturing herself, she's also nurturing the baby or the babies that she's carrying. And for people who have multiple babies, who are carrying more than one baby, they need extra care, they need extra attention to be paid to them to be sure that everything goes well. So antenatal clinics are scheduled depending on various facilities have different days for which when women come in for antenatal care. And also in the early state of the pregnancy, um, the visits usually is every 4 weeks, then later in the pregnancy every 2 weeks, then at the end of pregnancy the women are advised to come in every week until they begin to see signs of labor, which they are usually taught in the antenatal clinic, and then until delivery. So antenatal care, like I've said before, very, very important, so that pregnancy problems, maybe blood pressure problems, visual problems, any problem at all is easily detected when you have a comprehensive antenatal visit, you know. And nowadays, I usually advise women when they go to antenatal class, don't get distracted. Don't go there to go and talk with your friends or to go and, buy baby clothes and all of that. Focus on especially the health talks. Very, very important and very, very vital information is given during the health talks during antenatal clinic. And then all the tests and all the things that are supposed to be done, blood pressure checks and all, are usually done, and then anyone who has a red flag is usually detected, and then they can carry on to tackle the problem. So I've spoken about preconception care, antenatal classes, very, very important, and a woman should not miss out on the good benefits of having a comprehensive and well done antenatal care. Now, let me move to postnatal care. And so, postnatal care is comprises of all the things that we do immediately a baby is born, even up till the first year of life. I'm speaking, on the premise that the baby is delivered, there are no problems, mother is fine, baby is fine. First of all, the mother is fine. We ensure that the mother is fine, she's in a good state of health, there are no issues, there are no complications post delivery. So immediately the baby is born, usually the healthcare providers will take care of the baby, ensure that the baby has a successful transition to extrauterine life, because what happens in utero, that is when the baby is in the womb, is completely different from what happens when the baby comes out. And one of the most important events when the baby comes out is crying. Very, very important, because my people will say until you hear a baby cry after delivery, you don't say congratulations to the mother. So, and what that cry signifies is that the baby in utero had been on oxygen that diffuses through the placenta from the mother. And the lungs usually in utero are not really doing much work. They just expand and contract for the lungs to practice how the baby will breathe when the baby comes out. So the moment the baby comes out and takes the first breath, the lungs expand, and that is the reason why the babies cry when they are born, because nobody beats them, nobody pinches them, nobody does anything to them. They just spontaneously cry because it's a reflex that must happen for the child to successfully transit to extrauterine life once the baby is detached from the placenta. And so, with that, oxygen gets into the lungs and from there circulates around the body. And that is very, very important because once the baby doesn't cry, the lung doesn't expand, and the baby fails to initiate its own spontaneous respiration. Parts of the body are deprived of oxygen, especially the brain, a condition which we call asphyxia. And this affects every organ of the body, especially the brain, and may lead to long-term neurodevelopmental issues. So it's essential that at the delivery of every mother, a skilled personnel that is skilled in resuscitating a baby, not only delivering the baby, but resuscitating. That means assisting the baby to transit to extrauterine life is present at every delivery. That's what we advocate, because some people, not everybody will deliver in a big hospital, not everybody will deliver in a tertiary hospital, but whatever health facility where a baby is delivered, a personnel that is skilled in helping a baby to breathe must be present at the delivery of the baby. And also, severing, cutting off the placenta is also very important. We must ensure that that is done with sterile equipment to prevent the baby from having neonatal tetanus or any problems thereafter. So the moment the baby cries, the baby is cleaned up, given to the mother for rooming in and for bonding. And then what next? What do we do after? The next thing to do is to put the baby to rest. Is to put the babies to rest. And this is important because babies should be put to rest at least, at most, about 30 minutes after delivery. The baby must be put to rest 30 minutes, up to 30 minutes after delivery, giving time for the placenta to separate, for the mother to be cleaned up, and for everything. But even for women who have abdominal deliveries, the moment the surgery is over, the mother can call for the baby, even while still lying there, put the baby to rest. Because I've had many cases where people will say, okay, because I had a surgical delivery, because I had an abdominal delivery, I can't breastfeed my baby just yet. I can assure you that if the pain after surgery is well controlled and the mother had been taught in the antenatal clinic how to prime her breast and to prepare for breastfeeding, and she has a positive mindset towards breastfeeding her baby, I can assure you that the baby will breastfeed very well, barring any complications or any issues, and the mother too will be fine. Breastfeeding is very important because it helps the uterus to contract, and it helps the mother to get herself in shape right on time, and it provides the opportunity for the baby to have colostrum. Colostrum is the first milk that the breast produce immediately after delivery, and is very rich in fat, in antibodies, in what the baby needs in the first few days of life. So breastfeeding is one of the major things that we must initiate immediately a baby is born. So to mothers out there, or to pregnant women out there, I just want you to have this mindset that the moment you have your baby, you want to put your baby to rest. You want to breastfeed your baby. And I tell you, the more you put the baby to rest, you initiate the milk letdown reflex, and more milk will come. Because many mothers usually will complain to me that, oh, I'm not lactating, oh, the milk is not flowing. Just put the baby to rest. So after breastfeeding, usually from birth, children are immunized, and that's very important. Immediately, they are given the BCG vaccine that prevents against tuberculosis. They're given hepatitis B vaccine and also oral polio vaccine. And then the other things to look for, especially in the neonatal period, what's the demeanor of the baby? The baby, an active baby should be vigorous, cries all the time, feeds on demand, feeds, and then when you put to breast, the child sucks well, the child is vigorous, the child is not floppy, the child is not just sleeping for many hours without waking up. So those are the things to look for. And also jaundice. Jaundice is yellowish discoloration of the eyes or the skin of the baby. And it's a natural process, because when the baby is in the womb, the baby has a lot of red blood cells to be able to carry the oxygen from the placenta round every part of the body. But once the baby is born and the lungs are functioning well, the child no longer needs as many red blood cells as the child was born with. So the body starts to break down these red blood cells, and the byproduct of the breakdown is what is called bilirubin. And that bilirubin is a yellowish pigment which shows in the eyes or the skin of the baby at eye levels. And so it's usually, very visible in the eyes, but on the skin of a child is not usually visible, because we are Africans and we are dark skinned. So it should also be looked out for. And then the moment you notice that the child has jaundice, there are steps to take, because there is physiologic jaundice and there is pathologic jaundice. Physiologic jaundice is bilirubin levels at normal range, which happens in almost every baby. But at very high levels, bilirubin causes permanent brain damage in children. So that's why we make a lot of noise about jaundice and about serum bilirubin levels and all. So on the third day of life, every child should have their serum bilirubin levels checked. Or if jaundice is noticed before the third day of life, the child should also have the serum bilirubin levels checked. And so based on these levels, we then take a decision on what to do. For physiologic jaundice, if the child is well breastfed, it usually resolves by itself. But if it's pathologic jaundice, the child will have to go through some processes, phototherapy, to reduce the level of the bilirubin, to take it down to normal, and then thereafter the child is fine. Some people, do a lot of things to try to bring down the level of the jaundice or to reduce the serum bilirubin levels. Giving antibiotics is not the way. Is not it doesn't do anything to physiologic jaundice, except if it is pathologic jaundice that is also associated with neonatal infections. That's the only time where you give antibiotics if a child has jaundice. But if it's just physiologic jaundice or pathologic jaundice, maybe due to blood group incompatibility and all, what to do is to breastfeed the baby adequately, put the baby under a phototherapy light, or in very high levels, we might need to do an exchange blood transfusion. Talking about phototherapy light, a foundation that I'm also connected to is giving out phototherapy blankets, so that even mothers can have phototherapy done in their home. They take out the baby to check their serum bilirubin. They can have the phototherapy done in the home while they are bonding and rooming in with the children. It helps them better. They're able to breastfeed. They are able to rest and relax compared to being in the hospital. But in situations where this is not readily available, I advise that the child be taken to the hospital, serum bilirubin levels checked, and then you allow the healthcare practitioners to take their decision on how to help the baby. So I've talked about immunization, breastfeeding, jaundice, very important. Then cord care is also very important in a child, because I've seen people apply all sorts of things to a newborn baby's umbilical cord stump for it to heal. I can assure you those things are not needed. They are not needed, and many of them are harmful. They lead to infections in a lot of newborns, and very, very, very serious infections, to be specific. Now, there's this practice in my culture that they put rags together, they put some leaves in it, they burn it, and then they apply it to the umbilical stump so that it can heal. You don't need to do all that. The umbilical stump will heal by itself. All you need to do is to clean it every day to clean several times a day, not even every day, several times a day with methylated spirit and cotton wool, and also to apply chlorhexidine gel to it, and then it dries up and falls off naturally by itself before the first 7 days of life, all things being equal. So applying toothpaste, dusting powder, chalk, different things I see people do, and applying hot fermentation does not help with the umbilical cord healing, and it is usually harmful, because we've seen cases of newborn children coming in with burns on their skin where they apply the light from a lantern or the light from a stove or hot fermentation to their umbilical stump. Also, hygiene is very important, because newborns have very limited immunity, and so making sure that the environment where the baby is, for the mother, for the baby, and for everyone is sparkling clean. No dirt, no germs, no flies, mosquitoes must be prevented so that the baby and the mother do not come down with infections. So the next thing to talk about is continuation of breastfeeding. The baby is out from the healthcare facility and now the baby is at home. In the first few days of life, the first 1 week to 10 days of life, babies will lose about 10% of their weight, but thereafter they begin to gain the weight back as they settle down and they breastfeed, they latch on. Latching, very important. Positioning for breastfeeding is one of the things that they teach in antenatal classes, and also the breast of the mother. Some people, it is after they've delivered and they are having problems with lactation that we discover that they have um, flat nipples or ingrowing nipples or nipples that are turned inwards such that the baby is not able to latch very well on the nipple, and that precludes the baby from sucking very well. And at the end of the day, there's no suck, no milk let down. It leads to something that we call lactation failure. The milk just doesn't come, or the milk just stops flowing. So, in this kind of situation, in the antenatal period, please ensure that your breasts are checked. Anybody listening, mothers, fathers, pregnant women, people who are, who already have children or are planning to have children, ensure that your breasts are checked in your antenatal period and that the nipples are well formed so that when the baby is born, there are no problems latching and breastfeeding well. So babies breastfeed all the time because breast milk, liquid gold, very yummy, very sweet. Babies love it a lot and they just want to suck from morning till night till the next morning, all day and every time. And that is what mothers should do actually. Breastfeed your baby all the time. Don't wait till the baby is crying or the baby is cranky or fussy. Just breastfeed. You look at the visual cues. Oh, you already know my baby is ready to suck. So you pick up the baby and then breastfeed, breastfeed, breastfeed. The WHO recommends that babies be breastfed till 2 years, the first 2 years of their lives. And babies, breast milk contains a lot of nutrients, a lot of nutrients. So much nutrients that they're even advocating that adults should start looking for breast milk to have, good brain development. And you can, if you have breastfed your baby well, you can bear me witness that babies that are well breastfed, they come out excellent. Good skin, good hair, good brain formation. They are brilliant, they are smart, they achieve their milestones on time, and they rarely fall sick because breast milk contains a lot of antibodies from the mother. It's a form of passive immunity. So the baby already gets some form of immunization from the mother through the breast milk. So I advise that everyone, please breastfeed your children, and as much as you can, up till the age of 2 years. um Immunization is also very important because it prevents the children from having the killer diseases, the infections, or the disease conditions that can, bring problems or complications to the life of the child in the infancy period and even later in life. So, for in every primary healthcare center, most health facilities, they render immunization services, and this is important to make sure that the child gets all the immunization as it is stated. In Nigeria, according to the Nigerian program on immunization, is taken at birth, at 6 weeks, 10 weeks, 14 weeks. Vitamin A is started at 6 months, then at 9 months, 15 at 1 year, and then at 15 months. There are other special vaccines also that are not subsidized by the government but are available in the hospitals. Please avail yourself and your child of the opportunity to receive all these immunizations so that you don't spend big money or get into one form of trouble or the other if the child comes down with any of these conditions. The next thing I'm going to talk about is developmental milestones. It's very important that a mother or anybody that is taking care of a child knows when and how a child is supposed to achieve a particular developmental milestone and to know what to do when they see that the child is falling behind or a child is not achieving this milestone as at when due. So milestones are in different, let me say, domains. There are different domains. We have the motor milestones, which is the one that most mothers or most people are familiar with, and then we have the sensory or the speech and communication milestones also, and the verbal milestones are also there. But for the motor milestones, which is usually the quickest ones that a mother can note, is achieving neck control at about 3 months. The child is able to sit without support at 6 months, crawling at about 7 to 8 months, and then walking 9 months to 1 year. Tooth eruption is also one of the milestones. Usually from around 6 months, the child starts to erupt the first tooth till about 1 year, and at the end of 1 year, the child should have about 6 to 10 teeth. Now, before I carry on with the other milestones, let me stop and talk about teething. Is very important because I see a lot of children, once they are after 6 months, they have one issue or the other, and usually their mothers will attribute it to teething. Cheating is a natural process. It's not a process that should bring any harm or any disease or any infection to children. What usually happens is that around the time that the child erupts the first tooth, around 6 months to 7 to 8 months, that is when the child, usually at that time they are in the oral phase, they want to pick up everything around them and put in their mouth. The child is curious about everything in the environment. Everything you give to them, they put in the mouth. And then by that, they take in some germs or they get infected by some germs, which leads to the things that we see: fever, passage of watery stools, poor appetite, and all of that. And so, over the years, people have attributed that age of teething with those infections that we see. I can assure you that I have seen more children who just erupted their tooth or their teeth without any problems, no fever, no skin infections, no cough. Because when you see a child 9 months to about 1 year, child has been coughing for 2 weeks, has all sorts of skin infections, they attribute it to teething. Teething does not cause, in its own natural pure state, does not cause any of those infections. It's just the things that are associated with that area, that age period: crawling, picking things, putting in the mouth. That is what leads to the infection. At most, when the tooth is coming up, it might be the child might feel a little discomfort in the mouth, and usually the child may just have a slight fever or just maybe fussy for about a day or two, and after that, for most children, is self-limiting. But when you see a condition persisting for over a week: diarrhea, skin infections, cough, balls on the head, that usually is not due to teething, pop and plain. So it's very important that you know what to do when your child is about to erupt a tooth. They always put their fingers in their mouth. You may feel that some part of their mouth or the sides of their cheek may be a bit warm when the tooth is coming out. You can imagine how it feels, like something like a pin, like a sharp thing is piercing through and coming out in the mouth. So the child, on the gums. So the child may just feel a bit uncomfortable, but it's usually self-limiting. And for most children, no intervention is needed. Some may just be a bit more clingy. You just breastfeed them more, show them more tender, loving care, and then they are fine. The use of teething powders and teething mixtures is absolutely not necessary, and it is very, very dangerous. I'm sure you've heard about the My Pikin case that happened a few years back, where a lot of children died from a teething mixture that they use. Most of the teething mixtures that are out there in the market is just a mixture of paracetamol and chlorpheniramine, which just makes the babies sleep. And of course, they claim to try to use it to reduce the pain and the discomfort. But I tell you, if you breastfeed your baby well, you cuddle them more, they will be fine. So that's that about teething. Um, about the other developmental milestones, cooing and babbling. Usually, the baby used to start babbling around 4 to 6 months. By 9 months, crawling, cruising, which is when a child holds on to a chair or a stool and is trying to move around with it. And by 1 year, 14 or up to 14 months, a child usually will start walking. So you know that there's a problem if at 3 months the child has not attained neck control or thereafter, except if the baby was born preterm, where you have to give some gap for the time for which the child came before 37 weeks. But if the child was born at 10, 3 months, no neck control, 6 months, the child is not sitting without support, no cooing or babbling, no visual fixation, that means the child does not, look directly at an object, or you notice any abnormal eye movement or abnormal movements of the hands or the limbs, or the child is just completely quiet. The child is not, interacting with the mother. There is no bonding. There are no visual cues that the child give out. Then you know that that is the time to visit your healthcare practitioner and lay your concerns at their door. So if you have any child that you see is faltering, is not achieving these milestones at the time that the child is supposed to achieve. At 1 year, the child is not making any sounds, there are no words, the child is not communicating, not interacting with the environment. You need to visit your healthcare provider. Um, the other thing I want to talk about is introduction of complementary feeds after the first 6 months. The WHO recommends that mothers are to breastfeed their babies exclusively for the first 6 months of life without addition of water or any other substance. That is what exclusive breastfeeding is all about. That's why I mentioned earlier that you need to start to put your baby to breast immediately after the child is born, barring any complications or any issues. Even if you have had an abdominal delivery, if you've had a surgical delivery, or if you had any repairs after delivery, still hold on to the child and put the child to breast. By that, the lactation will come in on time, and then you have, the milk is flowing well, so there are no problems with lactation at all. So after the first 6 months of life, it's time now to introduce complementary feeds. And the reason is because at that time, the child is growing so rapidly at a rate at which the breast milk is no longer sufficient to provide all the calories, all the nutrients that the child will need. And so at this time, we need some add-on materials to add for the child to eat so that the child continues to grow well. I think in another of our series, I'm still going to talk about nutrition generally in children. It's very important that we know this because it forms the building block and the foundation for a child's growth and development. So what are the things you can introduce to your child after 6 months? What you introduce is very important because you need to know what is affordable, what is readily available, what is feasible for you to sustain. I'm not going to recommend that you start any complementary feed that is not nutritious or is not something that is sustainable or affordable for a family. So it must be safe, accessible, and then it must be, of course, palatable to the child. So there are a wide range of local or readily available food that can be processed and given to a child to take. Now, consider the baby is coming from a basically milk diet. The baby is used to having, just milk alone. So that's not the kind of baby you introduce solids to. You start with semi-solids like pap, like cereal, fortified pap, like cereal. You can introduce that. And I usually advise mothers, you start gradually, you start, one at a time. Don't put too many things together. so that you can vary the texture, you can vary the flavor that you are introducing to the child. So pap, the different types of pap, whole grain pap made with corn, millet, sorghum, and all, and then fortified with some add-on, follow-on milk can be given to a child. And then cereal, some already contain milk, some you need to add your milk to it, prepared and served to the child. And then you still continue breastfeeding. Then you introduce some protein food, fish, flaked chicken, and all well boiled and mashed potatoes, purees, fruit purees can be introduced to a child at this point. I'll still talk more about that in our episode on nutrition. So my time is almost up now. So generally, today I've spoken about preconception care. A woman has to prepare herself for the journey of pregnancy, because the preparation makes sure that we have a healthy mother and a healthy baby at the end of 9 months. And also, I talked about antenatal care, how very important it is that a woman be closely monitored and have a regular checkup during pregnancy. And also, I've talked about post conceptional care, the things to do in the immediate newborn period, and then after the first month of life up to the first year, which is the infancy period. I want to say a very big thank you to everyone for listening to this episode. We'll be back next time to talk about something else. And if you have questions and comments, you can reach out to us after this time. I'll be more than, it will be my pleasure to listen to have your questions and to also have your comments on this program. Once again, I've been OLAYEMI DUROTOYE. Thank you very much for joining us, and God bless you.